Hi, this is Jake Meyer with WAVE Physical Therapy and Pilates. Today we're going to be talking about cupping and how cupping can be an effective treatment both in the clinic and something you can do at home. So first off, what is cupping? Cupping is a manual technique that you can use similar to any hands-on treatment to help with pain, helps get your tissue to move and glide better, increases blood flow to the area, helps decrease your sensitivity in your pain areas or nervous system. The thing that's different about cupping when you're using these little silicone cups compared to most manual therapy, a lot of it's pushing, where we're compressing the spine or tissue, holding it. You're doing massage, which is compressing, or your foam rolling, which is compressing. Whereas cupping is doing the opposite. It's doing suction. So you're actually separating or getting some lift. And that lift can allow blood flow better, lymphatic flow, get pressure off of your nervous system, things like that to help treat pain. So it can be a really effective treatment both in the clinic, and it's a fairly straightforward one you can do at home with some guidance and some education. So just to kind of get a little education on what you can potentially do at home so you can continue some treatment to yourself, you can get some silicone cups. They're not overly expensive. They come in different sizes. They're real big ones. These are about the smallest they get. And that's what I recommend for like home use. All you would need is just a little bit of lotion, and I'm just gonna show kind of on the medial part of my calf. So just a little bit of lotion to kind of slick up the joint so you get a good seal. So there's three ways you can do cupping. One, you can do a static hold, where all you would do is depress the top of the cup to make less air in there, set it on your target area, and then let it go. And as you can see, it kind of suctions up my skin a little bit. And you might be able to see through the cup how it kind of pulls it together, creating a low pressure system in there to get a suction. And you can just put on that tender spot and leave it there 2 to 5 minutes. The thing about leaving it one spot too long, if you remember seeing Michael Phelps when he was swimming, he made it popular where you saw all those purple rings. Leave it too long, it can give you a red spot. So I don't recommend holding it there too long. It's not going to cause any damage, but it will give you a mark that will be visible for a while. So maybe after 30 seconds or a minute, you can kind of slide it to another spot. And if you put too much suction, like I did, just to demonstrate, like it's not going to move real easy. So you have to release a little bit of pressure, just kind of break the seal. And then you can move on to another spot. So you can see I got a little red, but you can see it's already recovering. And then you could come to a spot just below it, kind of tracing that muscle all the way down. And then just kind of adjust the tensions you need to. So that'd be static cupping. You could do dynamic cupping, where you can drag it up and down, almost as if you were like massaging with your hands, but you can kind of drag it up and down where your pain sensitivity is. When you have hair like that, it kind of breaks the seal a little bit, so you might have to either shave or just keep resealing a little bit. But you can kind of go up and down, just getting that separation of the tissues. And then the third way, and if you're doing the dynamic, doing it for maybe 30 seconds to a minute and then move on to another area or give it a chance to recover. And then the other way you can do it is dynamically, where you put it on a spot and then just do some active muscle pumps. So you're kind of like holding that out, gliding the muscles underneath that. And you could do that like that, or you could just do like some simple calf raises as an example when you're doing the calf. The nice thing about cupping, you can treat, especially if you're doing it to yourself, you can treat anywhere in your leg pretty easily, your thigh, side of your hip. You could even get like your upper trap, side of your neck a little bit, and then just kind of do the same thing. So you can leave it there for a couple minutes, do some dynamic movements, leave it there, do some arm movements, some things like that. If you have further questions, leave them in the comments or reach out to us here at WAVE PT, and we'd love to help you out with your pain and show you how you can keep managing your stuff on your own.